Good morning. My name's Don Seymour, and I'm the Executive Director of WOTCH for the past 10 months, and very pleased that you're all able to join us here this morning. To our elected officials, thank you for coming to our house and taking part in what is going to be an announcement about an exciting partnership between WOTCH and London Health Sciences. And would like to point out that we have representatives from both of the professional teams of London Health Sciences and WOTCH, so thank you for being part of this announcement this morning. So we'll get right to our program, and it's my pleasure to introduce the Honourable Chris Bentley.
Well, thank you very much, Don. Great to be back at WOTCH, and I'd like to say to you and all those who work so hard in this therapeutic community, thank you very much. Thank you for being there on the front lines. We were all together, Khalil, Deb, and I, and so many in this room, all together recently and celebrated your 40th anniversary. We were together with a friend who's no longer with us, Dr. Mountain, and we remember him and the great work that he's done. Today, though, is a real day of many emotions for people in this room. Dealing with an area I understand that doesn't always get a lot of attention. Delighted to be here with Khalil, and delighted to be here with the Minister of Health, Deb Matthews, whose riding we happen to be in. Delighted to be here, I expect, to talk about an area in which my mother-in-law worked as a psychologist for many, many years. And delighted to be here with Dr. Campbell. Now, if you have the Minister of Health and Dr. Campbell, who is in my office so often, I thought that he should be paying the rent instead of the rest. There must be some very, very good news. So with no further ado, I would like to take this opportunity to introduce the MPP for London North Centre and the Minister of Health and Long-Term Care, Deb Matthews.
Well, thank you so much, Chris, and I'm delighted to be here with Khalil and with Chris. We work hard as a team, and today I think we're really celebrating that teamwork and what we can accomplish when we work together. Far beyond the three of us, we're celebrating a wonderful, wonderful multi-personed partnership today. I want to back up and before I make the announcement and just set a little context. I think everyone in this room understands that the issue of mental health, mental illness, is one that simply has not received the attention that it deserves to have seen for a long time. It's been an illness that has been in the shadows, has been not discussed, has been highly stigmatized. And the great news is that I think that's starting to change. I think more and more people are standing up and talking about their experience with mental illness. And if you remember, it wasn't that far along where cancer was a word that people wouldn't say. Cancer was a disease that people were afraid to admit they had. Well, we've come a long way with cancer. It is no longer stigmatized. We're on the track to destigmatize mental illness. We're not there yet. We've got a long way to go. But I really do think that as mental illness becomes destigmatized, more and more people like me will understand we simply must make significantly more investments in mental health to treat people as early as possible, as close to home as possible. And that's why we launched our mental health and addiction strategy. My predecessor, David Kaplan, made mental illness, mental health, his number one priority. And he established a group of people to give us guidance on what we should include in a long-term mental health and addiction strategy. So that group worked very, very diligently and gave me very good advice. We also had a select committee of members of the legislature from three parties who worked together in a very unified and collegial way as they traveled the province and heard from parents, heard from providers, heard from people with a history of mental illness about what we needed to do to better support people. The culmination of that was the launch just a few months ago in June of our long-term mental health and addiction strategy, Open Minds, Healthy Minds. And it lays out a very ambitious plan to begin to take the steps forward so that people who are suffering from mental illness have the same kind of supports as people suffering from any other kind of illness. It's all our body. It just happens to be an organ located in our brain, not located in our abdomen. So as we move ahead, recognizing earlier mental illness, we know that 70% of adults who suffer from mental illness actually began to show those symptoms as children and adolescents. So we need to get into our schools. We need to have appropriate supports. The waiting times for people seeking care are unacceptably long now. So we've got a lot of work ahead of us. So we launched our strategy. We attached a significant amount of money to that strategy, $93 million per year at full implementation. One of the areas that was identified as needing new investment was the area of eating disorders. I was delighted that our expert panel and our select committee came to the conclusion that I had already come to after significant and multiple conversations with one Dr. Robbie Campbell. Robbie made a very compelling and convincing case in a way only he can do, that we need to do better. We need to do better for people who are dealing with eating disorders. I knew from personal experience friends of mine who had children who needed to go abroad to get the care they deserved. I'm absolutely overjoyed that Kelly Hull-Holland is with us today. It is her courage. Dinny Greenaway, where are you, Dinny? Right here? Yeah, there you are. Dinny's granddaughter, Kelly's daughter, as you will hear, Mikhail, actually passed away as a result of an eating disorder. And I think it's safe to say, Kelly, that you had a choice of how you were going to handle the grief. And you chose to work very hard so we could be here today. And I really want to applaud you and your mom for your courage and your strength in advocating for today's announcement. So I'm very, very pleased that we're going to be moving forward to address what has been a real gap in healthcare in this province and in this part of Ontario. So we are going to move forward with a comprehensive eating disorders program located here in partnership with London Health Science Centre and WOTCH. It will be a program that will provide care for people earlier, closer to home. There will be 4 beds in hospital for those people who need that kind of very intensive support. There will be a residential component for people who are either coming from away or from the local area who need the intense support of a residential program, but not the very intense support in a hospital. There will be day programs. There will be support for people after they leave the intense residential program. 100 people a year will benefit from this program. It will be far better care than we can currently provide. We send many people out of country for residential care now. It is a growing, fairly rapidly growing line in our out-of-country envelope. And not only is that expensive care, it also loses the continuity of care. And I think of all the arguments that Robbie Campbell has made to me about what is missing is we can send people away and they can get on the right track. But when they get home, they just don't have the supports to stay on the right track. So now they will. And I am ecstatic. I am over the moon excited that we're going to move forward with this program for people suffering from eating disorders. So it'll be, as I say, 4 inpatient beds, a full-time day treatment program for 20 people, part-time program for 32 people, an 8-bed residential home for people who need that, outpatient care, nurse practitioners. In total, it's $2.4 million a year. And this just might be the best $2.4 million we'll ever spend. I want to say thank you so much to Dr. Sandra Fishman, Sandy Whittle, Linda Stevenson from the Lynn, Ross Collishaw from WOTCH, Don Seymour from WOTCH. So many people have made today possible. I could tell you that in my time in this position as Minister of Health, I've seen many wonderful things. But it's so wonderful to be here in London, where the partnership to make this possible had its genesis. I know that people have been working on this for many, many years. I think, Sandra, you told me you've written 10 different proposals and now today this is a reality. So thank you to everyone who is there on the front lines to support people facing the challenges of mental illness, people with the courage to face those challenges. And I am just absolutely delighted that we are moving forward with this program right here. Thank you.
So I'm delighted to be back to WOTCH. I know not a long time ago, Chris and Deb and I, we came to celebrate the 40th anniversary for this incredible place. And today, I guess we're celebrating the partnership between London Health Science Centre and WOTCH, and celebrating also many, many community partners who came together to create this wave and convince the minister and convince many of us about this incredible program. I know Dr. Robbie Campbell used to go a lot to Chris's office, but it's happened to be my house across from his office, used to invite me all the time, try to convince me about his program. I know you're happy, Dr. Campbell, today, and many, I guess, in this room, I guess will be happy in the future when they see this program implemented in the City of London. As the Minister mentioned, it's important to send the people away, but when they come back, as Dr. Robbie Campbell mentioned, they have no place to get the support to continue the treatment in order to get them out of their issues and problems. So again, Minister of Health and my colleague Deb Matthews and to Chris, I want to thank you very much from the bottom of my heart for investing in this area, because I think this area needs a lot of investment, and I think London will be the leader in the province of Ontario, probably in Canada, and the leadership of wonderful people from London Health Centre, from the University of Western Ontario, and also will be also admire and the determination and of Dr. Robbie Campbell, who is great fighter and passionate about this issue. So to you, Dr. Robbie, and to all the people who watch in London Health Science Centre, good for you. Congratulations. And I have no doubt in my mind, every penny is going to be invested wisely and efficiently to show the City of London, the province of Ontario, Canada, humanity, what we can do in this beautiful City of London. And thank you.
Minister Matthews, Minister Bentley, Khalil, thank you very much. It's now my pleasure to introduce Sandy Whittle, the Vice President of Mental Health Program at London Health Sciences Centre.
Thank you, Dawn. London Health Sciences Center's CEO, Bonnie Adamson's out of town, so she's asked me to be here today, but to offer her congratulations to everyone for their work to get here, and also to thank the Government of Ontario for their ongoing support of our hospital. I also have to say I'm standing in for Beth Mitchell, Dr. Beth Mitchell, who unfortunately is in Austria. But this is something that has been very near and dear to her heart, and she was very regretful she wasn't here to share in the joy of this announcement. It is wonderful to be here today with our healthcare partners for this exciting announcement. The need has been long identified, and it's a special moment to see the proposal for this program finally realized. I want to thank our two partner organizations, WOTCH and the Eating Disorders Foundation, for all their help and the realization of this program. Your collaboration is integral to our success. The Ontario government's commitment to this important program is tremendous news. LHSC's Child and Adolescent Eating Disorders program is well established. Since opening its doors in December 2001, over 430 patients have been diagnosed and treated, from as young as 9 years old to 17. Now, with this new funding, we're able to offer comprehensive range of services, as Deb described, to patients 18 years of age and over, who traditionally have not had such services available to them. And Pam Allenbetz was saying earlier, she welcomes this because the adult, child, and adolescent programs have been getting calls from university and college students and haven't been able to respond. As Deb indicated, this adult eating disorders program will integrate varying levels of care, including up to 4 beds for inpatient medical care for the sickest patients, the day treatment program to serve those 20 full-time and 30 part-time clients, but also includes a strong focus on community and regional services, including that residential treatment facility, outreach workers, telepsychiatry, and other technological support, which will reduce the need for hospital admissions. The program will serve as a provincial resource and offer services to those living in London, Middlesex, Elgin, Oxford, Perth, Huron, Lambeth, Kent, Grey, Bruce, and Essex. So basically the two LHIN 1 and 2 areas. So on behalf of the physicians and staff of the LHSC Mental Health Program, I want to thank the government for this important funding announcement, and we look forward to the program's success. Thank you very much.
Thank you, Sandy. And now I'd like to introduce Dr. Sandra Fishman from London Health Sciences Centre.
Thank you so much, Don. I'm going to speak from my heart, not from any notes. I have had a career trajectory that's been intricately linked with eating disorders. So Beth, who really should be here, and I were very much part of working with the Eating Disorder Network of Ontario through the 1990s, identifying the need for an adolescent eating disorder program. And it's as Sandy says, eating disorders begin early. So it's a child and adolescent eating disorder program. And in 2001, we were just thrilled to finally have a funded program. And that program has been very successful. Early intervention is so important, but we know that there are a subgroup of individuals who need continued care into adulthood, and there are adults whose eating disorders begin in adulthood. And the tragedy that I think is often missed is that the mortality rate in adulthood for eating disorders is as high as 20%, and that mortality rate is in the prime of life. So in the mid-20s to the mid-30s is the highest mortality rate for eating disorders. And as Deb says, sending people away to get treatment is not terribly helpful. It's very easy to treat somebody in an intensive facility, get them well, get their weight up, but the psychological issues don't go away, and they need a very different and longitudinal form of treatment. So we're absolutely thrilled. There's another aspect of this that is thrilling, and that's the concept of having a continuum of care from hospital to community fits with a new vision of an academic health sciences network where not only can we treat people effectively, but we can also train future professionals to work expertly in the area. So in partnership with WOTCH and in partnership with the Eating Disorders Foundation, hopefully we'll be able to reach that vision. I've never had Robbie's capacity for persuasion. I've always wished I did. But thank you, Robbie, for doing whatever you did to finally make this happen. And thank you to our Minister and our Ministry of Health for making this happen.
Thank you, Dr. Fishman. I would now like to introduce the Chair of the Board of Trustees for WOTCH, Community Mental Health Services, Ross Collishaw.
Thanks, Don. Wonderful to sit beside Dr. Robbie Campbell. His passion and enthusiasm is contagious. Robbie and I are both Western grads, and we've attended many events together, and Robbie's pulled me aside a few times, and I know this is an issue that he has an extreme passion for, and it's a thrill for me to be here today to see his vision realized. So congratulations, Robbie. Yeah. On behalf of the WOTCH Board of Trustees, I'd like to thank everyone for being here this morning to participate in this exciting announcement for our community. WOTCH has been providing community-based services to persons living with mental illness in southwestern Ontario for over 40 years. WOTCH grew out of evolving understanding that some services and treatments for persons with mental illness work best when provided in a community-based setting. This new initiative will ensure that persons with eating disorders have access to local services which combine the best of two worlds. Community-based services working in full participation with the incredibly talented professionals at the London Health Sciences Centre. We are confident this partnership will develop an incredible program for persons with eating disorders that will become a model for others to emulate. In addition, this partnership can only provide a base to create new and exciting opportunities for mental health services in southwestern Ontario. We're profoundly grateful to Minister Matthews, she's always here for us, and her colleagues Chris Bentley and Cleo Ramel for their commitment to strengthening and enhancing health services in our community. We appreciate the vision and tenacity of Dr. Robbie Campbell with his work in making this long-needed service reality. Again, thank you for joining us here at WOTCH for this wonderful news. Thank you.
Thank you, Ross. I now get to introduce somebody I've heard so much about but never met, and hopefully we can formally introduce ourselves later, but it's my huge pleasure to introduce Dr. Robbie Campbell.
Thanks, everybody, but I just actually am so thrilled. I'm ecstatic that this is happening today. This has been a long time coming for the whole team. All of us are the team. I guess I never perceived myself as the person, but always have played team sports. And you realize that everybody plays a different position, and without this person doing that or this person doing this, the teamwork won't come together. I've been so impressed by our MPPs, Cleo, Chris, and Deb, because they work together as a team, and they listen. In the past, you really can't go and turn an MPP's ear and try to get some attention a little bit, but they've listened. I think my modus operandi is attempting to listen to the client and their families. I'm only thinking of Kelly and coming forward and the pain that families go through without enough help, without enough of us behind to support them. And Deanie, you've come forward as well, and I'm very pleased to hear you. But I think Deb's pointed out how much courage it takes to come forward we're dealing with the issues of the stigma of mental health, Deb alludes to, and we're getting there. And this is one huge start for eating disorders. We're looking at putting together a residential treatment facility that will, as Deb describes, be able to provide ongoing care. A continuity of care is so important in the model. So we're setting up a model that has the continuity of care and yet at the same time can provide equal access for all. And I think that's part of the platform the Liberals always put forward, and not to mention parties, but they have been extremely supportive, and I'm very grateful for them for listening. The other thing I'm grateful of is having the Lynns listen as well, because Sandra and Sandy, of course, help present to the Lynns. They have to have approval of their boards for everything, and then they have to carry it for the Lynns and put together a proposal that goes to the office. It's a huge process. They, too, are part of the team. And the team delivering the care are, one, we have London Health Sciences Center. Thank goodness, because they've always listened. And the team there has always been there, and as Sandy has mentioned, and Sandra, we've been through different kinds of proposals, and they're each much the same. And we have to, I think, make a strong point to people, and we have to pound our fist on their table, and we have to just step our presentation up a notch. So I think they're part of the team, and the team that is going to be carrying this forward with LHSC is WOTCH Housing. They've always been supportive. They're so super in dealing with us at Regional Mental Health Care and LHSC and the housing that they provide in the community, and we all know of their good works. And the other group, and thank you for being here, the Eating Disorder Foundation, and the board that has been so supportive of this for such a long time, and they would question if this could ever really come to fruition. And I'm pleased to have this announcement today because, board, it has finally arrived. Now our work begins. Thank you all.
Thank you, Dr. Campbell. Now I'd like to introduce Kelly Hall-Holland to come up and say a few words. Thank you.
Thank you. Thank you to the Province of Ontario and to WOTCH and to LHSC. As you can imagine, this is a momentous time for me. I want to thank my family for their support through all of this, and the friends and almost family that we have brought together. As Robbie says, it is a team. It has to be a team. Everybody works together. When I went in to jump a Grand Prix course, I didn't have to trot up on my own 2 legs to go over 5 feet. I certainly relied on the 4 legs underneath me. And when we did Team Nations Cup, you were always rooting for the whole team. But what I'm amazed about is the community of London, the phone calls I have received from the mums and the people suffering with an eating disorder saying, is this happening? Is this really happening? We're going to have a residential facility in Ontario? Yes, we know they've just opened this beautiful, beautiful place on Galliano Island in BC, and we're all cheering because we know that residential facilities worked. Mikhail, my daughter, was in the refeeding program. And what I found with the refeeding program is that, yes, it kept her alive, but it built fear and resistance in her, and she desperately needed more care after that. The next thing that I realized in this unknown path with somebody with an eating disorder was that the comorbidities that most of the adults that even at 15, 16, they at least have obsessive-compulsive disorder. They also may have drug problems, drinking problems, different comorbidities. Mikhail had pancreatitis by the time she was out of hospital, and she needed help and support with all of these different things that are happening with her. So to even get her into a residential facility in the United States took months because they didn't want to accept her. So what I'm leading up to is all the things we learned about and all the things that I found out about. When she came back, for her 3-day turnaround with her family, which was hours on a plane, which was difficult for her even then. The 3-day turnaround turned into a 6-week marathon to try and get her back to her program in the United States, because Customs said, you can't go back, you don't have a visa. What was she there to do? She was there for health. She was spending $1,175 a day, U.S., when it was not at par. Whereas this program is going to be $1,000 a month for the taxpayer. And OHIP picked up the tab for 5 months of that. Isn't this a better way to spend our money? Not only will she not have to spend years going in and out of emergency, trying CAMH but being too ill, spending 8 months in Toronto General, spending 11 months away from family when some people still believed in parentectomies. They thought that the parents were all the fault. And now they realize it's the parents and friends that support this eating disorder when they come home. They need that community. And this community has stepped up. It's been incredible. The doctor, when I found out also when she came back, she had a psychologist, excellent, a nutritionist, dietitian, and she had a physician, but they didn't talk to each other. So it was 3 excellent individuals that had no coordination. So with all of this brimming and Mikhail coming back and her last month in hospital had an eating disorder program that was for 18 years and under. She was 27. So she died in hospital at 27. And with all of this that I could see from my grandfather, Judge Brickenden, was not fair. Then when I started to look out for what I needed, miraculously, I had talked to Deb Matthews when she was still Minister in Children's Services, before she became the Minister of Health, and I had talked to her about how do I get Mikhail to the United States, and she helped. And OHIP was very quick. And just like emergency was the other night when I went in, they were very quick. Thank you very much. So then I started to find out, yes, there's a bill that's been passed, the Excellent Health Care for All bill, and that involves equality of care. And I had a message on my telephone from this man saying, Kelly, call me. This is Dr. Robbie Campbell. We have something to talk about. So when I came bursting into his office with mum in tow saying, I have all these things to deal with, and I listed them, and he started finishing my sentences. He had not only thought of this program that would take care of them from acute care with comorbidities, because he understood all of that. He already, which I couldn't find in other physicians, honestly, they hadn't had that awareness, that they didn't have to go away, that the parents and the friends would be supported, that they would have a team that works together, that it would cost a lot less money for the taxpayer, and the CA atypically wants to crow about that because Mikhail's care, when I tallied it up, cost the taxpayer, let alone her family, cost in dollars over $1.2 million. $1.2 million. This care is going to be $1,000 a month to the taxpayer over a 2-year program. That's $24,000. And of the almost 100,000 patients suffering with anorexia nervosa, which has this mortality rate of 1 in 5, that's 20 out of 100, and my daughter being one of them, that's billions of dollars. That's a small investment for billions of dollars. I want to tell you, Deb, my heart's full of gratitude. You had the courage and conviction to get that bill passed, Excellent Health Care for All. You had the courage and conviction to tackle mental health when everybody was saying it's the mother's fault, and now we know it's many, many layers. You had the courage and the faith in Robbie Campbell and his dream of helping those with eating disorders by using a residential care facility that will take comorbidities, will have a team, and, most important, telepsychiatry when they go home. And it was very convenient that Apple invented the iPad 2 for us, because they can take it home and they will be able to be reached with a remote cuff for their blood pressure, weigh scales where they don't have to obsess and be terrified about stepping on them because they won't see their weight. It'll come into our records. The technology is ripe for this. It is perfect. It's the best investment, and it saves lives. I'm so grateful to you. Thank you.
Well, thank all of you. I guess I could say the real work is now going to begin, but a lot of work has already gone in. But now we have to sharpen our pencils and get this thing going as quick as possible, and we will. So thank you, Kelly, very much. And thank everybody for coming today. We really appreciate the support, and we are excited about this partnership with three pillars of our community when you think about it. Community-based volunteer organizations such as the Eating Disorders Foundation of Canada, WOTCH Community Mental Health Service, and London Health Sciences. We are going to make something that is going to shine for people who really need services. So thank you, and we do have some refreshments in the room just across the hallway. Have a great day.